Minnesota for fraud schemes that targeted over $90 million in taxpayer dollars. Let me be clear up front about something. This is not the end of our work in Minnesota. This is not the end of the beginning of our work in Minnesota. This is the beginning of our work in Minnesota. The fraud here in Minnesota is shocking. Our cases today involve 7 different state-managed Medicaid programs that have been systematically pilfered by fraudsters who treated Minnesota-run programs as their personal piggy bank. One of the programs has been completely shut down because there's no money left. It's all gone. That was Minnesota's state-run Housing Stabilization Services program, designed to help the homeless find and maintain housing. It was estimated in 2020 that it would cost only about $2.5 million a year to fund this program, but it ended up costing almost 50 times that much, over $104 million by 2024 due to fraud. And because of all the fraud, Minnesota had to shut the program down in 2025, and now these services no longer exist for these vulnerable homeless populations. The same trends exist for other Minnesota-run taxpayer-funded programs. An autism program that cost the taxpayer $600,000 just 6 years ago skyrocketed to over $400 million. And to be sure, that number is not driven by supply and demand. It is not driven by health care or charity. It is fraud. To tackle this crisis, and it is a crisis in Minnesota, earlier this year, the Department of Justice surged 11 strike force prosecutors from across the country to be here on the ground fighting the rampant fraud targeting our taxpayer-funded programs. And large numbers of agents from our partners at the FBI, HHS-OIG, HSI, IRS-CI, and others joined our prosecutors to rapidly unmask fraudulent actors in Minnesota. These agents and prosecutors have been working around the clock to root out the criminals stealing taxpayer dollars, and I am proud of all they accomplished in such a short time. Their hard work made today possible. Make no mistake, today's charges are unprecedented. They include the highest loss amount ever charged in a Medicaid case in Minnesota and the largest autism fraud scheme ever charged by the Department of Justice. The common theme throughout these cases is fraudsters exploiting vulnerable programs and vulnerable people to enrich themselves, no matter the consequences to the programs or to the people. For example, one defendant is charged with defrauding the Integrated Community Supports Medicaid program. This program is designed to help individuals with disabilities live independently. One patient was supposed to be receiving 24-hour care through this program, but he was actually being serviced by a fraudster and received no services. This patient was later found dead. Meanwhile, the architect of this fraud scheme was billing Medicaid as if he was providing care to this patient. The defendant even submitted a claim of over $400 for services he never provided the day before this man died.